We are, of course, seeing a time of more illness right now. Flu, RSV, COVID, just to name a few, which means pharmacies across the country are feeling the pressure as they are right here in the Cooley region.
News 19's Crystal Flintrop spoke to a couple of pharmacies in the area, including one in Galesville, to see how they're coping.
We're seeing more shortages of medications than we have in the past.
Pharmacists are seeing an increase in people seeking over-the-counter medications and prescriptions compared to the last few years.
Flu wasn't too widespread last year just because everybody was masked, and now this year with some of the mask guidelines going away, people are getting closer contact with others, so it's spreading a little quicker.
As more people fall ill, the medication shortage makes it difficult to meet the needs of patients.
The big struggles is though with the pediatric population as far as OTC and that. Over-the-counter meds, we're having Tylenol, acetaminophen products aren't the drops are. They're basically non-existent.
And prescription medications are facing the same thing.
ADHD medications like Adderall, that's been off and on short supply for the last few months. Amoxicillin, preparations, antibiotics for kids is probably the most common one. Switching to an alternative antibiotic or a different strength of that antibiotic to get the same dose is what most pharmacies are doing.
Jennings says they're especially feeling the amoxicillin shortage in the Galesville area.
We usually end up having to call other pharmacies, and they're in the same situation. They've been calling us. Sometimes we get some in. We might get a bottle or two or a dose or two.
Both say to listen to your doctor and try to be patient with pharmacists when seeking medications. In La Crosse, I'm Crystal Flintrop, News 19.
Both pharmacists urge people to stay up to date with their vaccinations as well, and flu shots, especially right now, to try to stay healthy during this current surge.
And they also suggest getting out in the fresh air, eating a healthy diet, of course, and try to get no less than 8 hours of sleep.
Yes, some of those easier said than done, of course.
Exactly, and we know that all too well.